Okay, good morning, good afternoon, everyone who's dialed into this IAEA webinar on climate change and mortality. My name is Simon Brimmelcombe, so I'm facilitating and introducing the webinar, and I have Sam Gutterman who will be doing most of the presenting. We'll just wait, there's about 40 of us already on the webinar. We'll just wait another minute or so for any latecomers or people having problems with the dial-in, and we'll start in a minute or two. So in about a minute or two, I'll come back and start introducing the webinar. Okay, so I suggest we crack on. We have quite a busy hour ahead of us. So I'm very looking forward to this webinar. As I said, my name is Simon Brimmelcombe. I'm an actuary. I work for the International Social Security Association as part of the UN, and I sit on the Resource and Environmental Working Group together with Sam. I'm very excited about this report on climate change and mortality for several reasons. There's been a lot of work that's gone into the report. It's actually, although us as actuaries, we're specialists in the areas of mortality, this has been a very challenging area, very challenging report. Certainly less easy than perhaps it looked on the surface. A lot of direct impacts potentially on mortality of climate change, but also a lot of indirect impacts. And we've tried to quantify this in the report. I think this report is very important for two reasons, two professional reasons. Firstly, as actuaries, we should be adding to the debate with our technical skills. Mortality is an area where we excel. But secondly, actuaries should work in the public interest. And I think and I believe that climate change over the next couple of decades really will be the most challenging issue that society will be facing. There will, of course, be regional variations. But this is an area we really need to be adding to the debate, particularly as it involves issues such as risks, long-term predictions, and choices and policies ahead. That is really the specialist area of actuaries. The other thing I would say is climate change and mortality is perhaps an area much less studied than other impacts on climate change, and I think the interest we have when we go to meetings has been a real desire to see this report when it comes out. I've spoken to rating agencies who are very interested in it, and I'm actually based in Geneva in the same building as the World Meteorological Organization, who produce the climate change reports, and they're certainly already very interested in what actuaries are doing. So I'm looking forward to hearing Sam's presentation. Before I hand over, just a little bit of admin. As we go through, you will see in the WebEx that there is a space, a chat and a Q&A space. So please feel free, the questions that you have, please text them, write them in there, and we will answer the questions at the end of Sam's presentation, which will be about 40 minutes. So we'll have a good 15 minutes. This is a lot better than speaking, so please do add those questions in there. The more questions we have, the better it is. So without further ado, I'll now hand the microphone over to Sam, and I hope you enjoy the webinar. All yours, Sam.
Thanks, Simon, and welcome everybody. As Simon mentioned, we will be covering this. This is an IAA working group discussion paper. It is something that the Resources and Environment Working Group has been working on for more than a year now. with a group of devoted volunteers, including Simon. These are the topics that we'll be covering. The effects of climate change, particularly focusing on the effects on vulnerable populations, focusing on the potential mortality consequences, both adverse and favorable, briefly discussing a case study that's included in the report, and we'll complete our the presentation with a brief discussion of the role of actuaries in this area. The IAA Working Group discussion paper is now online at the IAA website. It is about 60 pages long with a couple pictures, so it's not totally words. And it's we hope that it's an interesting read, and hope that you will have time to skim all of it and read parts that are particularly relevant or of interest to you. As mentioned, it has been prepared by a working group. It is not a statement of opinion by the IAA. We completed it in September, and it further updated from this presentation. It is now on the IAA website, so you can download it or print it at your leisure. And as Simon also mentioned, it addresses an important potential result of climate change. Typically, climate change focuses on property, liability, even health, but relatively limited discussion on the topic of mortality, which is the reason why we started our papers, and hopefully we'll add to that as time goes on in this area as a result of climate change and, more importantly, the environment. Climate change will have a significant and wide-ranging effects around the world. It varies in terms of its temporal effects, that is, effects of time. Typically, we think of climate change as being a long-distant future event or a set of conditions, but that's not really totally the case. There is, as we've seen already, it affects the level and the variability in our climate. That covers temperature, but it also includes other climatic factors, and that's the reason why you hear a less reference to global warming, even though that's certainly one factor involved. But it also includes other factors, including precipitation and humidity. It covers not only the level, but it includes variability. That is, as temperatures warm, precipitations vary, we see more volatility in those factors around the world. So those events cover factors such as storms, extreme heat conditions, and extreme precipitation conditions. Typically, we think of climate change as being storm-related or event-related, but a key aspect, and particularly the long term, are what's referred to as slow onset conditions. This includes the often referred to sea level issues, but it also includes factors as ocean acidification and desertification. It's not desert, unfortunately it's desert. There's also, as Simon briefly mentioned, it also has secondary and even tertiary effects. It also has effects on water quality, air pollution, and food security. It affects geographical areas quite differently. In some areas of the world, climate change has an impact on increasing precipitation, for example, and others the opposite. As following up on my mention of regional variations, this pictorial picture shows two different scenarios. The Intergovernmental Panel on Climate Change came out a couple of years ago with its 5th assessment. I know it's busy working on the 6th assessment, and rumors are abuzz about what conclusions the climate scientists will reach. But this shows the change in surface temperature, and not ocean temperature in the oceans, but on the surface of the Earth, under two different scenarios. One on your left, which is referred to as RCP 2.6, refers to very substantial mitigation rapidly put into place. That means we suddenly change our ways. And the one on the right, 8.5, shows little change in emissions. That is almost a business as usual scenario. So these are very common scenarios that are used in climate change discussions. And you'll see in each of these, and this doesn't typically, when you see quoted climate change in Celsius or degrees Celsius, you will see it quoted from the pre-industrial age, that is back in the, around the middle of the 19th century. In this case, this is changed from the, let's say, on the averages of the 1990s. So you see a lot of differentiation, particularly when there is the business as usual or 8.5 scenario. I'm not going to dwell and focus in on the climate to damage process, although this illustrates the complexity of the process. And you can start from any part in this spaghetti soup figure. Typically, you think of starting at socioeconomic and political drivers, which then goes to emissions affected by technology, interfered with, hopefully with mitigation and adaptation efforts, and you'll hear those two terms a lot in climate change discussions, affecting the climate change system in your upper left, moving to effective climate change, then to both direct and indirect impacts. The direct ones are the fairly obvious ones that I've mentioned already. Indirect or second order includes zoonotic disease transmission. If you haven't heard that term, that's animal to human movement of disease, and including even the issue of migration. These are in turn both affects and are affected by your healthcare institutions and the infrastructure that has been developed in a particular location and in a particular country, which then brings us back to the bottom, which is the mortality and health outcomes, which we'll be discussing shortly. This is a chart that's included in the paper from the United States CDC, or Center for Disease Control and Prevention. At the middle, it's the basic factors of climate change, from temperatures, extreme volatility, sea levels, and carbon dioxide levels as well. Moving into the direct or first order changes, which includes extreme heat, severe weather, air pollution, etc., as you can see in the second order. The third, which is the factors that affect mortality or human health, range from the right side, which I'll talk about in a minute, various diseases, particularly focusing on diseases incurred around the equatorial area of the Earth, to down at the bottom to color and malnutrition, to the third order, which is forced migration as climate conditions change in different areas. As I mentioned, we're going to talk about the vulnerable population. Not only does that get affected in terms of their property, their location, their ability to live, but it focuses in on the especially hard-hit populations. These populations vary depending on the types of conditions or effects of climate change. They can be a whole entire country, a region, swath as temperatures affect certain areas in terms of the geography of a country, or population segments. And the population segments, I include those who are not as well off, and those, particularly those of the extreme ages, both elderly and youth, children. The vulnerable population, or the at-risk population, depending on what terminology you use, may not be able to afford protective measures or adaptation, as is referred to. They may not be able to afford to move elsewhere. They may have to be stuck on a river basin or in less expensive areas, which tend to be the less desirable. I was at a meeting of the UN in Princeton, New Jersey yesterday, and some discussion was relating to people who keep coming back to an area. Once flooded, as a sea level or rivers rise, they will come back after a couple of months after the geographical area is recovered, and the number of times that they come back after such events. Particularly areas affected by droughts and as well as flooding. Mitigation is obviously something that I prefer preventive medicine, but yet part of mitigation is the infrastructure of the country, and I'll be touching on that in the next couple of slides. The Netherlands in particular, talking to my Dutch colleagues, they have been working on adaptation, for example, through dikes for at least 900 years. And more recently, in the 20th century, there's been renewed emphasis on dikes and protection against sea level rise. But they're also, the vulnerable population are also affected by storms, as their living dwellings have less resilience. They then have to move to other areas and become part of the emigration. Some of the climatic factors, particularly that affect mortality, that I've even addressed in a couple of minutes already. Obviously, going through the key highlight areas of climatic factors includes temperature. That includes heat stress, as well as the secondary effects on air pollution. Air pollution is obviously a significant factor depending on geographical areas and areas of use of such factors as excessive use of coal. Precipitation causes famine, flooding, and secondarily forced emigration, particularly as conditions worsen. Storms, heat events, wildfires. I know that some people don't think that climate change causes wildfires, but it can very certainly be a significant factor in making things worse. I know I had a couple of friends in California whose lives are dramatically affected by wildfires. Not many deaths, but significant effects in quality of life. In some cases, as mentioned, climate change is only a contributing factor. One of the key new fields of climate science is the topic of attribution, which has not yet become stable in terms of trying to attribute as a cause, secondary or the percentage caused by climate change. It's a very difficult and challenging area. Whatever happens, as actuaries, we typically look at results, and so it almost doesn't matter in some cases. But after every storm or event, you will probably see some climate scientists who will be asked, "Well, was this caused by climate change?" That's one reason why some actuaries even just eschew whether or not it's really due to climate change. It's an event. In many cases, the insurance industry is affected, but typically not on the life insurance or mortality side. Clearly, this affects diseases. This is a list of some of them. Clearly, some of them are significant mortality risks, particularly to the vulnerable population. In countries near the equator, you'll see mosquito spread diseases. I just read a couple of minutes ago, a report just came out from the World Health Organization that the relatively steep decline in malaria-related diseases may have come to a standstill. That so far has not been that standstill has not been blamed on climate change, but yet it's a good example of conditions or diseases which, without climate change, would see dramatic improvements and climate change, increased heat and precipitation around the world. Well, it may stop those declines. Mention asthma, respiratory, and cardiovascular are certainly some diseases that come from an excessive amount of air pollution, which is exacerbated by higher temperatures around the world. So you'll see relatively recent reports on excessive air pollution in the Indian subcontinent. This is a concern because of not only warmer temperatures, but you add to that mix situations such as increase in urban concentration and urbanization, and that mix of risks exacerbates the mortality risk. And the last comment is especially true, which is, in this case, heat-related issues, which especially affect the frail elderly. Other adverse effects, some of which are obvious, some of which are subtle, not so obvious. Most people can overcome the effects of droughts and famine for a couple of days. I mean, it's no big deal. Weather is with us and always with us, and there's always something to talk about. But when carried to the extreme, that means it's lengthened, or the degree of climate change factors, how it turns into a catastrophe, as we've seen in various countries. Indirectly, even though it's a second or third order, it contributes to violence, and indeed, in some cases, even to conflicts. Several people have pointed to the Middle East as an area where extreme or lack of precipitation, increased warmth has contributed to the beginning of the conflict there. The subtle parts is that there's, in India, for example, there's been an increase in suicides as farming, particularly small farmers, have had an adverse effect. Farmers in the agrarian area of India have experienced over time a high correlation between warmth and number of suicides. We've seen in North America an increased ocean warmth, which can in turn increase severity. There's a lot of debate about whether it increases frequency. At least so far in current temperature conditions, it has not increased the frequency of storms, but in some cases they have increased severity, which is what will drive effects on mortality. I've mentioned also air pollution, so I won't go into that further. If temperature goals, for example, the 2 degrees Celsius goal or a maximum goal is not achieved, we may be able to see some nonlinearities in terms of overall health, which will lead into higher overall mortality. But it sounds like a gloom and doom presentation. I didn't mean that way, but we'll get into the other aspects of it, which is there are some favorable effects. As an actuary, I typically focus in on the risks. Well, some of it has, in some areas of the world, climate change is great. In winter, in the middle of winter, I don't mind having warmer overall weather patterns coming in and affecting me. it will improve some agricultural outcomes, although I mentioned desertification, that also may expand the arable land areas in certain areas of the world. So again, although it can become a negative in some areas, it can become a positive in others. Carbon dioxide fertilization, that is, in those areas, it can actually improve the ability of different areas of agriculture. As we move more toward adaptation, we'll also improve some quality of life. For example, as we fight the effects of heat stresses or heat stress conditions, there is certain parts of the world that can afford air conditioners that can reduce deaths. So therefore, some of our efforts at addressing local conditions of climate change can improve mortality. But on the other hand, when you have a big focus on use of air conditioners, you will have an increased energy use, which leads to increased carbonization. And that mentions the favorable effects of some of the efforts we use to mitigate climate change. That is, more energy efficient transport can also mean safer transport. It can also lead to lower greenhouse gases, which can reduce air pollution. And air pollution, I didn't mention it, but there have been various studies that have shown that air pollution leads to deaths in the millions, who came out with a report that said overall pollution causes upward of 6 million individuals getting lost, but 3+ million are caused by air pollution. And in turn, in the areas where there's improved agricultural development, you can have potentially better nutrition. So far, we've been looking at overall population effects, overall effects of total climate on overall population in the world. Well, as actuaries, we typically focus on are concerned with the non-vulnerable populations, that is, in the upper and middle income brackets, of those people who can afford either insurance or pensions. That's true. On the other hand, there can be exceptions. Natural disasters affects everyone, or can affect everyone. For example, my friends in California in the wine country were affected by wildfires. Their homes were decimated. I know some people whose houses have been burned down, not only their livelihoods, but their lives. And those are the well-off, as well as those in vulnerable areas. For those who are better off, their residences and workplaces maybe have more resilient structures, better constructed, better located, and therefore fewer losses and fewer deaths. They're able to have better health care. In some cases, the healthcare infrastructure can be overwhelmed. And in a sudden situation, this is an area where significant mortality risk exists. But on the other hand, there's other areas where actuaries have gotten more involved, that is in the micro or inclusive insurance space, through mobile telephony, sales of insurance. All of a sudden, insurance, as certain areas of the world are coming to realize that insurance is valuable, insurance penetration is hopefully increasing to prevent adverse effects to the individual households and businesses. In that area, social insurance can help, and so therefore the actuaries like Simon, who are involved in social insurance, see their populations are affected. We have a separate project ongoing in terms of the relationship between vulnerable populations and insurance, and I'm looking forward to that one that hopefully should be available next year. Actuaries typically look at what can we do in terms of analysis on a quantitative basis. It's challenging. It's challenging not only because the future is, although we can look to the past to get some data, some experience, future conditions, particularly in the intermediate, or not in the next year's situation, but maybe down the road somewhat, we don't have a huge database. And so therefore, because of a lack of databases, we are going to be, the quantification of this effect on mortality is going to be challenging. There is a great deal of uncertainty, and when I refer to uncertainty, you hear is not whether climate is changing, and it's pretty well understood, but yet where the hurricanes are going to be moving, what part of Florida, where's your local typhoon going to be hitting? Last month, I believe Ireland was a possibility of being hit by a hurricane. These events, and the likelihood is due to the volatility of our weather in the future. It's always difficult to predict famines, or we can predict that the glaciers are deglaciating, but yet we don't know the speed, and it's hard to predict. There are climatic feedback loops in the spaghetti soup of diagrams. It's clearly a complicated process, and if you want to get into the detail, it even becomes more complicated. But it's especially difficult and complex because of the time horizons involved and the fact that in many cases we are dealing with low frequency, high severity risks. But actuaries are used to doing that. I think actuaries can overwhelm. I see an increase in growing interest as I referred to my meeting yesterday at the United Nations, UNEP, United Nations Environment Program. There is an increasing interest in the area of insurance, and hopefully actuaries will be leading that discussions, and therefore providing some input in terms of the analysis. Stochastic analysis is clearly something that's useful, but in terms of factors such as extreme temperature, there's definitely basically two different techniques. One is a study of specific causes of death. In other words, you can look at and survey deaths that, let's say, Puerto Rico, they're still trying to figure out how many deaths occurred, and therefore they're going around to mortuaries to survey. Well, that's a real challenge to get that information on an accurate basis. So what is been done instead in the area of heat stress in particular is looking at trends in the excess of seasonal or situational averages. So as your winter mortality typically increases, the degree of that excess or the additional mortality is looked at to look to see whether or not how it's correlated and hopefully causative factors are studied to see the extent of that volatility and the extent of the level of additional mortality. One study, interestingly enough, Gasparini, and that's described in the report, indicates that there are more deaths at moderate deviations from average temperatures than extreme deviations. Well, one reason is because there's a lot more, or the moderate deviations are more frequent than extreme deviations. You don't hear about the moderate heat conditions. You hear about the stress conditions. And that leads to alternative approaches, not just stochastic analysis as mentioned in the last slide, but also use of scenario analysis and stress testing, particularly as to studying the effects on a financial institution that actuaries may be called upon to look at. As I mentioned at the top of this presentation, we do include one case study, and I think it's interesting in several dimensions. In particular, the case study is in the United Kingdom. There's been a number of studies. The conclusion, at least I would not say it's a universal conclusion, but certainly of several of the studies, that there are fewer deaths that may result as a result of the fact that there will be fewer deaths in winter, as extremes in winter are become less frequent, but they're more than offset by warmer and spikier summers. A major benefit, I believe, is going through that case study is the analytical process described. as well as just the specific conditions and the references made. However, the UK conclusion is not generalizable. Certainly various sources indicate a net increase in deaths will be likely for much of the rest of Europe, particularly the middle and the southern areas of Europe, which are generally warmer to begin with. The lessons learned, I think several commentators have pointed to the examples of heat wave in Paris. In the heat wave of 2003, there were a number of deaths occurred. But heat waves that have occurred in the last couple of years, we've seen a lot fewer deaths. And that's the reason for that is that Paris has better preparedness. They're better prepared in their health infrastructure to cover emergencies and better overall health treatment in such situations. But will that improvement occur universally worldwide? That's a challenge. It's an adaptation challenge, and it benefits mortality from certainly caused by either a primary, secondary, tertiary method from climate change, but also should be able to assist in other areas as well. An example in particular in vulnerable populations has been reported in India. Over the last 50 years, there's been a substantial increase in the number of mass heat-related deaths. That is, heat conditions, excess or extreme heat conditions, where there has been more than 100 deaths each. And so therefore, it's not been just a blip. It seemed like a significant trend in that area of the world. I've mentioned the role of actuaries. Certainly, actuaries should be looked at as those who study the quantitative aspects. Hopefully, the actuaries will contribute more to cost-benefit analysis for mitigation or adaptation efforts. Actuaries should be aware of what's going on. They should consider the implications for the assumptions made and communications of the associated uncertainty. Clearly, uncertainty hits before levels change, but that's one reason why scenario analysis and sensitivity testing will be particularly valuable to add to the actuarial toolkit. Some suggest even that the economic and demographic uncertainties are greater than those associated with climate change. That means as populations move, as populations become more urbanized and concentrated, the economic and indeed the mortality risks increase. So many of the demographic factors which actuaries are used to dealing with and studying will have dramatic impacts on the area of mortality. There is relatively limited short-term impact on most areas where actuaries typically work or focus their attention to, but nevertheless in some markets and in countries with significant vulnerable populations, both the direct and maybe more importantly the indirect effects may become more substantial. So even though we might think of, and I know when I got into environmental and climatic studies, I always thought that climate change was going to be a big factor in the year 2150 or 2050 or 2100, which are common years because people like to round. But yet they also some sudden or current situations, and they're obvious, at least they're obvious in the North American context in the last couple of months. But actuaries can provide objective viewpoints. I think actuaries can take leadership positions. There will be relatively a handful that will actually be studying the science, although I hope that every actuary can increase their knowledge. There may not be a unique answer, and actuaries are good at looking at uncertainties, looking at contingency planning, understanding the effects, and the interrelationships are very significant and important. Concluding my comments, my overall conclusion that the expected effects of climate change on overall mortality around the world may be relatively small compared to overall mortality. That is, you won't see next year or two suddenly the actual to expected mortality ratio to increase that much compared to other contributing factors. However, that's a big caveat. Direct and indirect effects may be significant in certain geographical areas, certain areas of vulnerable populations, and certainly may have a much more significant effect as non-linearities or inflection points get reached, and if we aren't as successful as our global effort to combat climate change. So the effect on mortality is in some geographical areas not so much, but some areas of significant concern. Those comments mostly relate to mortality, but the effect on public health, property, and other non-life or non-mortality risks may be extensive earlier. So this is an area where actuaries should be aware of and familiar. That concludes comments. Again, before questions, answers, comments, observations arise, the IA paper is on the actuaries.org website. This is the reference. Please feel free to download it, send the link to your friends, actuarial acquaintances, because I think all actuaries need to enhance their understanding. With that, turn over to Simon.
Great, thank you, Sam. Well done for covering a lot of ground in a quite short period of time. I think one interesting thing is the general knowledge both within the profession and outside of the issues. There was a survey launched today or published today in Switzerland that 85% are concerned about the impacts of climate change and actually ranks above issues such as unemployment, terrorism, and so on. But at the same time, there was a very low level of confidence in politicians to actually do the measure, put in place the measures to actually address this. The other comment is you mentioned, Sam, the regional distribution, of course, the distribution by social class and social group, so an overall effect may be quite small, but it's going to fall obviously proportionately more on the less well-off. For government, social security systems and so on, this may have a big impact, arguably more than for insurers who may only insure those in the formal sector. But this is certainly something for society needs to address because, again, a recent study came out showed that conflicts do depend indirectly on climate change issues such as water stress, crop failure, and so on. So I'd like to encourage you to ask any questions in the Q&A or the chat box. This is a good opportunity, and I've actually got one from Max who asks, which I'll hand straight over to you, Sam. What else is the IAA working on with respect to climate change? Perhaps you can talk about implications of this report, but the other work of the REWG as well.
We are particularly considering the nature of a lot of our work, which is based on volunteer efforts. We also try to leverage the efforts of our national associations. Certainly notable in that area is the North American Actuarial Organizations that has been publishing for the last several quarters the Actuaries Climate Index. If you're not familiar with that, I think you can Google the Actuaries Climate Index, and that's something that is a very, very interesting series of reports. The IAA is working on a series of topics, one of which is the impacts on investments. I know in my meeting yesterday on topic of insurance and climate change, there was a number of people from non-life, but even life insurance companies whose direct involvement is with investments. So that's an area that we have commented, made several public comments to the FSB's Financial Stability Board's task force. Another area topic that we've been looking at, or just starting off on, is area of the relationship between climate change vulnerable populations and insurance. That is, insurance can do a lot of protection on social issues or on protecting general population, but there are limitations, and so that's a project that we will hopefully be moving forward this coming year. Also, we're starting a project on flood risk, and flood risk is not just due to climate change, but it's an area that's due to that's subject to concern from, or is contributed by a lot of other areas. So certainly, it falls under the environmental arena. Also, another project which we have an early draft on, which is decarbonization. Hopefully, we'll have an impact in terms of contributing to understanding of some of these issues, some of which are not original research, but also some of it is synthesis. So there's a wide range of areas that actuaries are looking at, and the IA is delving into, and it also encourages its national associations to become either aware of being passing to its members topics that at least should be on the actual horizon or time horizon.
Great, thanks, Sam. I'd just add to that the IAA has a number of relationships with international organizations such as the International Labour Organization. And as I mentioned at the start, I am actually working in the same building as the WMO who produced the climate change report, IPCC reports that Sam referred to. And meeting with the Secretary General, he had already was aware of the Actuaries Climate Index. So there's a lot of awareness of the IAA work. So the IAA can impact directly, but it also through its work with other international organizations who are often on the ground. The IAA also inputted into the ESA Climate Change and Social Security report, for example. And so there are a lot of direct and indirect ways that IAA expertise can impact. And that means in practice, we have a number of examples of social protection which now take into account climate issues. So, for example, climate adaptive social protection in Ethiopia, where there is a cyclical social protection payment and where this depends on certain weather measures, so it impacts on the payout, the days of drought. And this was really inspired to some degree by some of the work that actuaries have been doing on quantifying risk and long-term trends. So there is a certain link between the work the IAA is doing and actuaries in general to work of other actors on the ground, whether that be UN organizations or even NGOs. Do we have any other questions from participants? Otherwise, I might ask Sam a question. So Sam, do you think, given that good, that saved me from asking someone. So a question from Dennis. Isn't the effect of improvements in healthcare much greater than the effect from climate change? And over to Sam as well.
It's a really good question. And that is not only are we talking about the level, but we're looking at the trajectory of mortality. Mortality, as every actuary knows, has been improving over in the decades and indeed centuries. Most people have thought that there is nothing that humans can do to change that trajectory. Unfortunately, the work of the IAA Mortality Working Group has indicated that the last couple of years, the trend in mortality may have stalled. I'm certainly not pointing toward climate change as one of those factors, but it is certainly one of the factors that will contribute to changes in mortality levels. I agree, and I point to the conclusion that the expected effects of climate change on an overall basis may be relatively small. And maybe that's the reason why mortality hasn't been studied quite as much as other factors where there is a bigger effect. But it's one thing dealing with averages, and another thing dealing with different population segments. Just like the improvement in cardiovascular diseases have not had that significant effect on mortality at the younger ages, in teenagers or in the people in their 20s. But yet it should be a concern. It is a concern on mortality. So this is an area where, in a case study in the United Kingdom, it may even have a favorable effect. But it's something that actuaries should be aware of because of the uncertainty and because of the variability and volatility. It should be actuaries should have one eye open. Should not be discarding it as being not relevant. It may not be relevant to your overall projections over the next 10 or 20 years on an overall basis, on an aggregate basis, but yet I think it's an area that actuaries need to be mindful of. So it's a good question, and that's not one of the top of mind questions where if you're in the study of mortality, that's an issue. But on the other hand, boards will be asking, and the public will be asking about what's the effect on your institution on climate change, and you should be ready to be able to respond.
Thanks, Sam. Yeah, I'd add to that one interesting aspect in UK was the reduction in life expectancy, which some explanation was due to the reduction in spending, health spending after financial crisis. And I think one of the challenges going forward is, will the impact of climate change on economic growth likely to constrain economic growth and therefore lead to less resources for health systems, or have an indirect negative effect on mortality as well? So it's the direct and the indirect effect. The other thing I'd say is probably that healthcare going forward will need to look more at preventative measures, and these can be a win-win. So, for example, meat production, meat eating is a huge contributor to climate change, but also has various negative health implications. So a move towards better eating, a healthy lifestyle as well, will reduce health costs, but also be a positive for climate change. Right. Okay. So I would say if there were no further questions, I'd like to thank Sam. Those who just came in at the end, you have a second chance. We have another conference call in 7 hours' time. Or if colleagues missed the call, please do let them know they have another opportunity. The report, Sam, do you want to just give a final detail on the next stages, discussion paper and the report timeline?
Well, again, the report's available. I think it's really well worth at least glancing through. There's some interesting numbers. We did not pretend to be able to look at, well, this is going to affect your mortality ratio by 0.2% because there's such variability. But I think there's a lot of useful information and references provided. And I think also the methodologies that are described briefly in the report is something that actuaries need to add to their toolkit and information that they can delve into as conditions or as situations arise that can benefit from that information. And if there's any questions that come up afterwards, you can send an email to me or to Simon or to any member of the Resources and Environment Working Group. And in fact, if you really start to become passionate about this area, you can even volunteer. And Ken Donaldson is the chairman of the working group, and we have representatives from several countries, but maybe not enough, because we like to hear from a wide range of views, experiences, and in fact, information sources.
And on that note, thanks very much again to you, Sam. Thanks for everyone who called in. We hope you found it interesting, and it not only stimulates your interest, but as Sam mentioned, your experiences and your expertise was always interesting and helpful for us. The more input we get, the better the reports are. Thanks once again, and have a good rest of the morning, afternoon, or evening. Thanks very much. Goodbye to everyone.
Bye.